Hey guys, I hope you're doing well. I just want to take a few minutes and cover some basic skills for group leaders. So I'm simply just going to identify a couple different particular skills that are necessary in order for you to have a good, efficient, and successful group therapy session, and give not only the definition but a couple examples on exactly how we use these particular skills. So the first one, really probably the most important in terms of whether it's a group setting or individual counseling, is simply just the idea of active listening. So a very common mistake that a lot of people very brand new to the field tend to do is when they're listening to another person, whether it be a group, individual session, they're not only just listening to that particular person, but they're so busy and wondering, okay, how am I going to respond? What information is important? What is so they're constantly kind of wrapped up in their own mind. They're not necessarily hearing what the other person is saying. Active listening is where we actively engage and we let the person know through our own words, such as paraphrasing and so forth, that we are hearing what it is that they are saying. Our active listening skills tend to fall back on both verbal, as I gave an example. A person describes to me how they are feeling within a particular moment. I then repeat or summarize what it is that they had said to me. That is a form of verbal active listening, or even just nonverbal in terms of our body language. So nodding, maintaining eye contact, having that open position, and so forth. So we want to make sure that we are demonstrating good active listening so that we can best help our particular client or group move towards accomplishing their goals or objectives. Reflection, very similar to active listening in terms of simply just reflecting back. So you've got a client, you've got a group member who talks about a particular situation, shares a particular situation that may be of conflict, of stress, anxiety, whatever it may be. And then you, as a group leader, will reflect that particular or basically summarize and put it back on them. Very often, we utilize what is called open and closed ended questions. Within reflection, we want to make sure that we utilize open ended questions. So, what I mean by that is when we reflect something back, okay, so very often you hear therapists say, well, how does that make you feel? Okay, closed ended questions can be answered with yes, no, one word answers, and it kind of leaves us kind of stuck. Open ended questions prize a little bit more in terms of that particular person having to disclose, having to evaluate, having to process a little bit more in terms of what it is that may be a challenge or an obstacle for them. So reflection is something that we may want to do. A good example, you've got, I'm reading from our book here, Alicia, I'm not sure how I'll do here. I'm a little uncomfortable with all of this, but I sure want to start making some changes in my life. So the group leader could reflect or come back and say, Alicia, you seem to be feeling that the group is both exciting and a scary experience for you at this point. So we're reflecting those feelings back. Again, a nice form of active listening by summarizing and using the same language in which that particular client did. Clarification and questioning, pretty self-explanatory. So we want to make sure that we have our individual across from us or a group being very clear in terms of their particular or disclosing their particular feelings. We want to question appropriately in terms of what is going on with that particular individual. A great example, you've got a person by the name of Stan in your group, and Stan says, I don't think we should accept the proposal. So maybe we're talking about group rules. It has too many hidden agendas. The leader comes back and says, Stan, can you tell us a little bit more about what you mean by that? Great example that actually came up yesterday. A person gets out of an inpatient setting. Person asks them, how are you doing? Person says, I'm fine. Okay, well, what does that mean? Could you tell me a little bit more about what do you mean by fine? All right, so questioning, clarifying, again, using open-ended questions to gain as much information as we possibly can. Summarizing, again, another great way of active listening. The person discloses in terms of the information they want to share. You then, in your own words, summarize that information back. Okay, so pretty self-explanatory in terms of that. Linking. Linking is great, especially in a group setting. So if you've got Bob in one corner talking about his particular challenges, let's say with alcoholism, and Susan starts talking about another situation in which she dealt with her alcoholism. Again, a great way to build group unity, a great way to build cohesion within that particular group in terms of collaboration. Susie, I see that you brought up several challenges and obstacles that have been problems for you. Bob seems to have identified some of the very similar things that you have identified, perhaps some of the strategies that Bob has utilized. Susan, do you think that you can use? So linking, again, mini lecturing, information giving. This really depends upon the group in which you tend to utilize, and also depends on really the setting, the context. Sometimes it works, sometimes it doesn't. Mini lecturing, information giving, pretty self-explanatory, kind of standing up front, uh, proposing a bunch of information, disclosing a bunch of information, usually educational materials or those types of things. The thing you really want to keep in your mind is with mini lecturing, again, you probably have heard this in the past. The average human can really only pay attention to information be disclosed to them for really only a couple minutes. So when you're standing there doing this, you need to keep in mind uh, the context of your group. Are you losing your group? Do they understand the material in which you're given? One thing that I often do is simply kind of this ping pong match. So I'll disclose a bunch of information in terms of educational stuff and ask them, how do you feel about that information? Do you feel this is something you can utilize? Have you tried these particular things before? So you're putting this information out and getting feedback from your audience to keep them actively engaged. Encouraging and supporting. Obviously, within a group setting, we want to build cohesion. We want these individuals to trust us. No one is going to make a change, whether it's individual counseling or group counseling, unless that particular person trusts you, unless the therapeutic alliance is established. So, encouraging people, supporting people, that's great. That's wonderful. Could you tell us a little bit more about how you overcame that obstacle? No matter how small you may think it is, it may be the biggest thing in the world to that particular person. So we want to actively keep them engaged in terms of what's happening. Tone setting. So within tone setting, it's not only just the environment within the group, but when I hear tone setting, I think of my voice. All right. So if you guys kind of think about that, the Peanuts, Charlie Brown, that professor that talked, blah, 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 it was always the same tone. One of the things that you really want to do within a group setting or individual counseling is utilize your voice. Up, down, emphasize, talk calmly, speed things up. Again, setting the tone in terms of what is important, what is not, how we're going to go about doing particular things. You don't want to always kind of maintain this monotone, boring type of voice. We want to keep people engaged in terms of what's happening. Use of eyes are nonverbals. One of the most important things in terms of a counseling relationship is always our nonverbals. I've been told more than once, and I'm a firm believer in this, that when you are evaluating, assessing, screening a person, their nonverbals almost tell you more than what their verbals are telling you. So maintaining good eye contact, especially in a group setting. For example, if you're mini lecturing, you don't want to just look at one person. You want to make sure that you are gauging everybody within that particular group, looking at one particular person, even within linking, talking to Susan, talking to Bob, making sure that there is that particular connection. Use of eyes, again, drawing out members, cutting off members, scanning for those nonverbals. So nonverbals could really be anything, slouching in a chair, looking in a different direction, sweating, legs trembling. Nonverbals could be their overall appearance. Those particular types of things can tell a lot about how a particular person is doing. One of the things that I often get a lot of questions about in terms of the individual sessions or group sessions, in terms of basic skills for group leaders, is the idea of modeling and self-disclosure. I'll touch on each one of these individually. You as a group leader are setting the tone. You are setting an example within your group. The same thing within an individual session. So you want to model appropriate behavior. One of the things that's so good or pro about group therapy is it gives your clients or students an opportunity to practice, to model, so to speak, certain behaviors that they are working on in a safe environment. And again, you as that group leader are setting the tone on how those particular things are going to be done. Same thing with group rules. So you want to set the tone and how to appropriately engage others within that group in what is considered appropriate behavior. Self-disclosure. Self-disclosure is a very tricky hurdle, so to speak, especially within this particular field. Self-disclosing information simply just means that you are sharing very private information about a particular topic. Depending upon the person, depending upon the group, depending upon the individual session in which you were in, it can be very, very powerful. It can also blow up in your face. So one of the things that I often encourage a lot of brand new clinicians going out in the field is simply don't do it. Don't do it. The reason why is if it's done incorrectly, okay, it really takes the focus off of that particular client and puts it on you. All right. For example, let's say that as a clinician, you are somebody who is currently in recovery for alcoholism, right? And you're working with a client that is going through the same thing, in terms of struggle with sobriety. You're talking about ways in which to minimize relapse and things like that. And you sitting there, hypothetically, maybe getting frustrated, in terms of that particular client and not being able to maintain, abstinence or whatever. So you feel that you may be able to make a personal connection with this person by sharing your story, the things that you did that worked. Okay, visualize that. Now, it's no longer about him or her, it is about you. Ethically, we just don't do that. We can't do that. Now, I'm not saying that self-disclosure is a bad thing. With the appropriate training, the right amount of experience within the field, it can be very, very powerful. So you just need to know when and how far you can go with it. I had a group a very long time ago, a general addiction group, and I had a client who really challenged me and said, "Who are you? Who are you to talk to us about our addiction? What experience do you have? Blah, 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 blah." Well, this was an opportunity for me to really connect with this individual, not just him, but the other ones in the group. So I smoked cigarettes for 10, 15 years. So again, everyone's addiction to their own. But I thought that, okay, I don't know what it's like to be you. I'm not in your shoes. I couldn't begin to imagine how hard it must be for you in terms of your particular addiction. However, I smoked cigarettes for 10, 15, some odd years. And I remember how hard it was for me to give that up. However, this is not about me. This is about you. So you can see how I'm self-disclosing very little information without getting into details, and then immediately reflecting it back on that individual. Yes, I'm not you. I couldn't begin to imagine. However, I have been through something very similar. I feel there are some things that may be able to help you. However, this is not about me. This is about you, and we're here to concentrate on you. Very, very important. And again, it takes, I'm not an expert at it by any means, but it takes quite a while to learn how to appropriately do that in terms of self-disclosure. Cutting off, again, a very difficult thing to do, especially if they're people who are new clinicians. Cutting off, probably the best example I can give of this is within the screening and assessment process. So very often I get new clinicians who come to me and say, I got to get the screening done. I got to get this assessment done. We've only got a certain amount of time and a certain amount of days to do it. And this person is just unloading on me. I don't know what to do. In situations such as that, you need to be very blunt and honest and forward in terms of, this is what we're here to do. This is what needs to be accomplished. Again, I couldn't begin to imagine. This must be very, very hard for you. However, there's going to be a time and a place in order to address that. If we want to get to that, we need to get this done first. Same thing within a group. You're going to have certain people that are there for a wide variety of different agendas in terms of what they want that group for. Some people may simply just be there to vent, to start fights, whatever it may be. You, as the group leader, fall back on group rules. What were some of the group rules that you guys established? Also, who are some of your allies within that group in terms of some of the other clients that can support you in terms of cutting this particular person off? And again, really addressing and being very forward and direct with this particular person. Couldn't begin to understand. This must be very, very hard for you. It seems as if you have a lot of things that you would like to talk about. Maybe group is not the most appropriate time for this. Maybe dealing with your individual clinician, that is something that we can discuss, or maybe even after group, this is something that you and I can process. Again, use of voice, setting the tone, good in terms of maintaining the overall group atmosphere and pacing the group. So we want to make sure that we are sticking to a regimen. We are sticking to a time in terms of what needs to be accomplished, what are the objectives, what are the goals. And at the same time, understanding that a good amount of time, what you have planned for group just ain't gonna work. So you have to be able to fly from the seat of your pants. You have to be able to be creative. You have to have some sort of backup in your mind in terms of what that is. For me, whenever I did groups, I was always aware of what was going on in the news. I was always aware of different topics. I was always aware of different new things that were going in the residential hall, thing like that. So if the group just fell apart, we talk about that. How do you guys feel about this? What's going on over here? What's happening over there? Always have something to fall back on in terms of that. And obviously some basic understanding, and I'll kind of stop on this one, is you need to have a good cultural competency, or at least a good general understanding of what that is and how it impacts the group dynamics in terms of you being a leader, not only within the individuals you're working with, but also the person you may be co-facilitating with. And what I mean by cultural competency, I'm talking about race, I'm talking about religion, I'm talking about spirituality, I'm talking about whatever, gender, anything. How are those things, or why are those things particularly important in terms of the overall therapeutic process for your group? How are you going to address them and move forward? Okay, so those are just, again, a basic generalization in terms of some of the key important skills in terms of group leadership. All right, thank you.